Hey everybody, it's Kman. I'm an emergency physician at Ohio State and do disaster response with Ohio Task Force 1, which is Ohio's FEMA urban search and rescue team. I did a little video blog last week for the Columbus Medical Association, and I must not have screwed it up too much, so I'm invited back. One of the things that I wanted to talk to you a little bit about is quarantine and protecting your family during the COVID outbreak. So why don't we have a little conversation about that? I learned, I don't know, this is probably 18 or 19 days ago, that I had a low risk COVID exposure. And as was appropriate to do, given the fact that I didn't have any personal protective equipment on, I was put into quarantine. And so, I want to tell you that self-isolation and quarantine isn't the end of the world. If you have a house where you can partition yourself off from the family, I was able to be very productive in my office. And actually, the last video that I recorded was from my home office. This is my work office that I'm in right now. But what quarantine is separating yourself, a person from a group of people that haven't been exposed to an illness. And I was able to isolate myself at home. For COVID-19, the period of quarantine is 14 days because 14 days is the longest incubation period seen for similar coronaviruses. So when you're on quarantine, you have to stay home except to get medical care. Essentially, for emergencies, you can leave. So what I did was I isolated myself in the office for the day. There's a bathroom adjacent to our office that I was able to use and wipe down. It's important not to share things. It's important to clean high-touch surfaces daily. We have an extra bedroom that I was able to use. And, essentially tried to do social distancing within my house, which is a challenge, but not impossible. As far as transmission, COVID-19 appears to spread most easily with close contact with infected persons. So if you're too close, you can breathe in the droplets. And so within your quarantine, you have to try to stay, away from your loved ones if you can. The reason this is important is there's a lot of talk now about how healthcare professionals function at home and how to keep your family safe. So one of the things that we're doing here at Ohio State is we're monitoring everyone who walks into the door. So the first thing you have to think when it's time for you to go to work for your shift or, when you go work in the clinic is, do you have symptoms of COVID-19? So if you have symptoms, and just about every one of us has been exposed to someone, if you were exposed without personal protective equipment, then, you need to immediately self-quarantine and get a hold of your employer. What we do here is we check our temperature prior to reporting for work, and we have an app that does that. Or when we walk in the door, we get our temperature checked and we have to log in and we have to put everything in there. So it's just important that you do that. Now, when you get to your shift, how do you function within your shift? So the way I did it when I worked in the emergency department this week is I wear a simple droplet mask, which is also a surgical mask. So this is a droplet mask and then eye protection. If you have a droplet mask and eye protection and you come into contact with a patient that is unknown to have COVID but later found to have COVID, and you weren't doing aerosol generating procedures, then you shouldn't have to go on quarantine. So the reason we wear this during our shift is if I see a patient for a sprained ankle, or I see a patient with a shoulder dislocation who later tests positive for COVID, and I don't have my personal protective equipment on, I have to actually go on quarantine, which is, what happened to me is I had an interaction and wasn't protected because I wasn't working clinically at that time. So this is kind of how we function in the ED. And you're going to wear this for the duration of your shift. And, when you wear the mask, keep the mask on. We see a lot of masks on chins, noses exposed, things like that. The other thing that you can wear while working is a droplet mask with the eye protection, associated with it. So this has the eye protection. I'm good here as well. So that's important. I talked about the half face piece last time, so I won't really go into that. But what I will say is this. When it comes to the N95s, it's been pretty well publicized that Battelle is helping our region with sterilization of those masks. So I think what I've heard is they're using vaporized hydrogen peroxide. Here's the important thing. Guys have to shave. Women, you can't wear foundation or a moisturizer or makeup because it can contaminate the mask and then it won't be able to be recycled. And like we talked about last time, we are concerned about supplies, staff, and space. We need those three things to take care of these patients, so we got to do this the right way. One of the things that I didn't talk a lot about last time, though, is when you wear this, you have to make sure that every time you don it and doff it, that it gets deconned. So, you have to decon this. And so sometimes it's better if I'm going to go ahead and put this on for multiple patients. So, let's say that I'm going to do an aerosol generating procedure and I'm going to put this on. I have to make sure, it fits, that I have good seal. I have to make sure that I have eye protection. So I actually have these. If I'm going to do an intubation or something where I'm going to be really into contact with the patient, I can wear those. Otherwise, I can wear these. So I have to make sure I have eye protection. And again, when we take this off, we got to decon it. So one of the recommendations that I've heard is if you're going to put this on, go see multiple COVID patients at once, because every time I don it and doff it, there's a risk of droplets. I'm touching my face, I'm touching the mask, and I have to decon it. So, if you're going to wear this, sometimes as an attending, it makes sense. The residents present 3 COVID positive patients. You could decon it while it's on you, but every time you take it off, you do run a little bit of a risk. So just know if you're going to wear that mask, that it's probably worth maybe seeing multiple patients. One of the things that I thought was great is, I went in to see a COVID positive patient, took the patient's vitals, put them on the pulse ox, see what their pulse ox was. And actually this particular patient was fairly healthy, not somebody who was in extremis that needed to be intubated or anything like that. But it was a patient that needed some IV fluids. So I went in, did my thing. The nurse went in, did her thing, started the IV, and then we gave the patient a Cisco phone, put the phone number on the door, and for most of the rest of the interaction, we were able to communicate by phone. And that was helpful because they understand the door has a window too. So I could see him or her. I'm talking on the phone, I'm looking at the monitor, but we're limiting our exposures. And, while I'm on that topic, I'll just shout out the nurses have been, incredible. As doctors, there's only so much we do. The nurses do the real heavy lifting. And so they're the ones that are in and out of the room. And so I really applaud, Emily, who helped me with that patient, and the other nurses that are just doing a great job with this stuff. So, I had this up last time. I talked about the different masks. A procedure mask is also called a surgical mask, is also called a droplet mask. Those are the ones that we want to wear for the duration of our shift with eye protection. In case we see a patient, we're covered with PPE. And then again, aerosol generating procedure, intubation, somebody's going on BiPAP, somebody's getting a test swab, that's an aerosol generating procedure. We need to go with a half face piece or an N95. Now, seeing a lot of people living in their garage or at a hotel, that may be what you need to do. I'll tell you what my process is, and I may change it. Everything within COVID is changing. But if you can, no jewelry, no watches, no personal items at work if you can help it. If you do wear those things, they need to be deconned. Leave your work attire at work if you can. If you wear scrubs and the hospital will launder your greens, leave them there. If you don't, which, I usually don't wear scrubs. I usually wear, like 5'11", pants or, cargos with scrub top, because I need pocket space and, I need my trauma shears and things that I carry in my pockets. So my process is leave the shoes in the garage. There's been literature that shows that the virus lives on your shoes. Leave the shoes in the garage. I'm lucky because the minute I walk into the house, immediately to the right is our mudroom with our laundry. So I walk in there, everything comes off, it goes in the wash on hot. I do the walk of shame to the bathroom, picture Game of Thrones when, you're walking through your house, people need to respect your privacy, but you got to go straight to decon. You take that shower, you wash up, do a full decon. People forget about the decon process. When we were in Houston for Hurricane Harvey, we were in floodwater that was contaminated, fecal, petroleum, garbage, whatever's in there. You got to get your shoes clean, your boots clean. You got to get them off. You got to get clean. Don't forget to wipe down your pens, your stethoscope, your ID badge. Don't forget this bad boy. It's been dangling around everything. And you really got to decon all that stuff. So right now, I'm not living in a hotel. I feel like I have a pretty good process, straight to laundry, straight to shower. I've even been telling, my wife when she goes out, she worked at Children's and, to come in and you really should be deconning. As far as we talked about the disinfection of the face piece, just make sure you're deconning your face piece because otherwise, there's going to be virus that can live on there. I also talked about, extended use of the half face piece if you're wearing that. I would just recommend that if you're not comfortable with wearing a half face piece, even though it feels like it's going to be more secure, if you're fit tested for an N95 and that's what you're comfortable with, that's fine. It's better to be comfortable with what you have than be fidgeting with it and my hands are in there and I'm touching my face and I'm uncomfortable, and instead of taking care of the patient, I'm worried about how this thing's on my head. Wear the N95 if you're more comfortable with that because, it's just important that way. So I think that's pretty much what I wanted to talk about today. Being on quarantine, self-isolation, again, social distancing, and then when you show up, a surgical mask with eye protection for the duration of your shift, because if the nurse that's in the or the doctor that's in the station next to you doesn't have that on and tomorrow tests positive, if you were protected, you shouldn't need to go on quarantine. So I'm happy to answer questions if there are any. My email address will be up on this, and I'll try to keep bringing these to you and try to keep everybody educated. But thank you.